Welcome participants. This is COVID-19 risk communication orientation session for all our risk communication as well as other cluster partners. This orientation session is being organized by Ministry of Health South Sudan and being supported by UNICEF, World Health Organization and South Sudan Red Cross. Here I am Soumitra Roy, C4D consultant from UNICEF. I also have my fellow consultant Lillian with me. She's also from UNICEF. We will take you through this presentation and we are going to have this presentation all of us together.
Welcome participants. This training is meant to bring us to the same understanding of what risk communication activities and strategies are being used to contain or to curtail the COVID pandemic in South Sudan. So this presentation will help us to prepare better and for you to be able to integrate or plan specific activities for COVID-19 response. So what is coronavirus? Coronavirus is an infectious disease caused by a newly discovered coronavirus. It is classified as a public health emergency of international concern, simply said, pandemic. Now, it was named COVID-19. COVID, CO stands for corona, VI stands for virus, D stands for disease, and 19 stands for 2019, which is the year when it was discovered. Now, it's important to know that there's a lot of unknown about the coronavirus, how it behaves and how it is presenting itself in different situations. So currently there is no vaccine, although there are many trials going on, and there is no specific treatment for the coronavirus. The disease is spread mainly through two modes of transmission. One is respiratory droplets. When somebody who is infected coughs or sneezes, the droplets containing the virus spread around, and if somebody is nearby, chances of that person breathing in these viruses into his body or her body are high. The other one is through contact transmission. So if somebody is sick and you touch that person with unprotected hands, you too are exposed to the virus. We do transmit, we can get the infection through handshaking. If you contact somebody who is sick through handshaking, you can get infected. Or if you touch the surfaces which have been contaminated by the virus, specifically if somebody coughs near a table or any surface, the viruses can drop or spray themselves on the surfaces, and if you come touch the surfaces, you get your hands contaminated, and if you touch your eyes, mouth, and nose, you have a high risk of transmission. So anyway, there are also people who are transmitting the disease, who may transmit the disease and they are not visibly sick, or those who are infected and they do not show symptoms at all. So we have different groups of people who get sick, they don't visibly show the sign, or those who get sick and they will never show any signs, but they do transmit the disease. Is at risk. Every one of us is at risk of contracting the disease. However, there are some people who are at higher risk of getting a severe form of the disease. These include the elderly, for obvious reasons, the body is already worn out, and there are people of any age who have underlying medical conditions, diseases like diabetes, heart disease, hypertension, malnutrition, all those increase the risk of a person who has these diseases. The other one is those who have, the other group is those who have reduced immunity, especially people living with HIV. Now, what are the signs and symptoms of the coronavirus? According to the Ministry of Health case definition, anybody with fever or at least a dry cough, difficulty in breathing or tiredness, this is a classical presentation of COVID disease. However, as we have said, that there are people, especially in South Sudan, we've seen a good number of people, over 80% of people who do not show any signs of the symptoms, and yet they are able to transmit the disease. Now, we have some key messages which have been approved by the Ministry of Health. So we have presented these in different formats, in what we call the information and communication materials. So we have the signs and symptoms highlighted on this slide, which are showing the wording and the illustrations to ensure that we all speak the same message as we communicate. Then the other one shows the signs and the preventive measures, which include hand washing, frequently hand washing with soap and water, which is important. And when we wash with the soap and water, we need to do a practical session whereby we help everybody understand how to wash all the parts of our hands so that we remove the viruses or any other infective agents in our hands.
Okay, participants, just to add to the information Lilian just shared, these posters, leaflets, banners, they are free to be replicated at your end. So accordingly, we have our artwork ready for printing at your end. Only condition is that please do not change any message. Do not remove any of these logos which are originally present in these posters, banners. But you are free to add your own logo in it while you reprint this. So we do have our archive from where we can always share those artwork with you so that you can replicate this.
Yes, we were talking about the preventive measures, so which have been highlighted, hand washing, not shaking our hands, basically because the hands have a key role in transmitting the virus from wherever it is to our bodies. So we need to have non-touch contacts when we're greeting. And I believe that many of us have probably identified one way or the other to do that safely. The other one is to avoid contact with people. So you avoid contact with anyone. So which means that you have to keep a distance between yourself and other people, including those who are sick and those who are not sick. So this is an important intervention and of keeping space between yourself and others, especially when you go outside your home. And again, even in the offices, we need to ensure that we have adequate space to spread out and make sure that we are protecting ourselves from contracting the disease. So the spacing that is recommended is anything beyond 2 meters, because there you are really safe from breathing in the droplets from a person who might be coughing or sneezing. The other message that has been added on in the new materials which have been produced is to avoid group eating. This came out of the perception studies that have been done to identify the risk factors within, or the risky practices within our communities. And this one came out very clearly that we have to reduce on the way we gather together and eat together, because that one, when everybody is around one space, it increases the risk of transmission. Again, we need to emphasize that gatherings gatherings, either in markets, in places of worship, or any other public place. Now in South Sudan, they have opened up, they have allowed the bars and other places to open, but please, we need to make sure that we avoid gatherings. The other one is to do with the respiratory hygiene, where you are encouraged to use a tissue or when you are coughing or sneezing, and to cough in a bent elbow, or what they call the flexed elbow, to make sure that the virus does not move far. It stays around yourself and you are able to control it. So the other key thing, which is actually now very important, is staying at home when you don't feel good, if you feel sick, especially if you have flu-like symptoms. So you stay at home and you call for help and guidance. You call the toll-free line, the Ministry of Health toll-free line, 6666. It has been strengthened. It is now able. It is manned by more people, so they are able to answer quickly to your responses, to your needs, and advise you accordingly. So if they interview you and find out that you fit in the case definition, then they will trigger the next action. But otherwise, everybody is supposed to stay at home until advised to move out, because those with mild and moderate symptoms, even if you are positive, you are encouraged or advised to stay at home. Those who have severe signs and symptoms are assisted to go to the treatment facilities. So one key intervention that has been endorsed by the Ministry of Health or the government of South Sudan is the use of face masks. This is a new intervention which has been introduced, and we are providing guidance in terms of IC materials to give proper guidance on how to effectively use the face masks and how they are made. So the face masks are supposed to be used in public places, and it's really an intervention to stop the spread of the disease. There are different types of face masks. There's the disposable ones and the reusable ones. Mostly the disposable ones are the medical masks, which are preserved for the medical workers. But for us, me and you in the community, we are advised to use the cloth masks, which are reusable. And it's very, very important that we all learn how to use it so that we provide the good example to the other communities. So one key thing is that before touching the masks, you must wash your hands with soap and water. Then you use a clean mask, which is not torn. It's visibly clean. Then you put the mask on properly. We've been seeing many people putting on masks, stylishly around the neck, or it's not proper. You have to cover your mouth and nose properly with a mask if you have to use it. The guideline is there, and we are producing it in different languages, so it will be able to guide our people. The reusable mask must be washed, preferably after every use, with soap and water, and where possible, please iron so that it is clean enough to be used. However, there are some important areas where we need to emphasize. First of all, children under 2 years are not supposed to wear these masks because they can interrupt their breathing because they don't know how to manage the mask. So eventually you can cause a problem instead of solving one if the child suffocates, for example. You are not supposed to touch the mask if you're putting your on. You don't touch in front of it. If you have to remove it, you only hold the elastics which are behind the ears. But if you happen by accident to touch it, you have to wash your hands with soap and water. When you're removing the mask, please don't touch your eyes, nose, and mouth because it increases the risk of you introducing the virus in your own eyes. So prevention is key to stopping the spread of the coronavirus. So in addition to using the face mask, we must abide with the other preventive measures that have been discussed and agreed upon by the government, which includes the washing of hands, the physical distancing, the good respiratory hygiene, to mention but a few. The physical distancing is key, and it has been proven that it can stop the spread of coronavirus. So we as risk communication partners or humanitarian partners, we must be exemplary and adhere to this physical distancing, which means that we have to maintain at least 2 meters distance between ourselves and anybody else, yourself and anybody else, because it starts with you. You need to ensure that there's enough distance between you and other people at places of work, in other public places. You really have to make sure that there is space. You have to use these masks, and you have to regularly wash your hands. So observing physical distancing measures have to be ensured while doing any form of training or orientation, house-to-house mobilization, the way our mobilizers have been operating. We're encouraging them to use megaphone announcements so that they are away from the communities when they are providing that information. Even meetings, unnecessary meetings should be cancelled. But if you have to have the meeting, probably there are other opportunities like what we are promoting now, and other virtual ways of communication. There's technology helping us to meet even when we can't meet physically. So community engagement is also key, and we have to ensure that there is physical distancing. So this we are trying to train and introduce new ways of community engagement so that we don't bring people to discuss issues together, but we bring a few key ones who are agents of change, who can inform the communities and cause change in the communities. So this is the only way we can do the community engagement, not the previous way we were doing it. Now, as I said earlier, we need to stop the group eating, which is very popular in this country. So because it brings people together, and as we said, you don't even know who is sick because some people don't even show any signs, as we have pointed out earlier. So all forms of gatherings should be regulated as much as possible. So we need to emphasize physical distancing in the way we do our business. The vehicles we use probably in our organizations, we need to make sure that we physically provide enough space between ourselves, and we use the masks as provided. So looking at the landscape in the fight against coronavirus, we have identified some challenges or barriers which have been which are being addressed within the interventions that we are doing. One of them is that the disease is new, as we have pointed out earlier. The disease is new. There's a lot going on. A lot of studies are going on to understand this disease and how it behaves. So because of the limitation in terms of knowledge, at times we might get questions from the communities which we are not able to answer. Suffice to say that with risk communication, you do provide the information that you have, and you can always go back to provide additional information. So there is less known about the disease, and therefore we might be at risk at times because some ideas have not come out clearly. So that limitation in knowledge, especially in the form of transmission, as we have said, is a challenge. But of course, we are trying as much as possible to bring new knowledge as much as we can. Our health systems are not equipped enough to address the COVID-19 cases, especially the severe ones. We have a few facilities like the infectious disease unit in Juba, and a few other facilities have been identified. But if we get a full-blown spread and we get many people who have very serious conditions, we might not be able to manage, and that is very serious. So there is another group of people who are vulnerable, those who are in IDP camps, the POCs, refugees, and mobile communities. They are vulnerable not only to the COVID disease but other risks of other diseases. So this is a challenge because even if you come in with your messages on COVID, they still have other issues around them. Now we have the stigma stigma has come in as a key problem which we need to address, because it's a barrier to our interventions. So it's affecting the response in terms of people hiding when they are ill or they are not feeling well. Or if they suspect that they are sick, they don't come up quickly. They want to avoid discrimination, because if somebody is known to have either contracted the disease or had a contact with a person who is sick, because of stigma, they are not able to come out quickly. So it prevents people from seeking health care immediately, for example, calling the 6666, and it discourages also people from adapting the healthy behaviors. So there's a whole intervention to address this stigma, and we'll talk about it a bit later. So another challenge is the geographical diversity and harmful social cultural practices, which we need to identify and agree with the communities on how to overcome them. I think one of them is what we talked about earlier, highlighting some of the cultural practices of how we do business. There's low perception, because this is linked to the symptoms that we've talked about, that it's a fever, cough, those are common things that happen. So people don't take it seriously that this is a new disease and what is new in this disease. So there's always that fear. And again, it hasn't been presenting seriously in this country to the extent that we have just recently reported a death. So all these are factors affecting people from taking serious this disease. The poor health-seeking behavior is also another barrier, because many of us don't even seek for medical help or any information on health until you cannot tolerate the disease or the pain anymore. So that is a problem which will delay seeking for help in time to avert complications. The rumors are also another challenge, because this is coupled with the limited information that we have. So whoever gets information tries to provide it, and sometimes we ourselves are involved in providing, sharing information unknowingly, because you find a nice WhatsApp message coming in, you quickly send it to all your contacts. Little do you know that it's probably not a confirmed information. So we have to be careful that whatever the messages we receive, we verify. We have sources of verification. We shall talk about how we are tracking the rumors and how we can quickly identify those which are false, those which are true, and see what measures to put in place to mitigate them. So the rumors are a high risk to the people, because many people get information from different sources. So especially in Juba, we have really many sources of information, and if not monitored properly, we can end up getting people confused. So we will introduce you to the form which is being used to enable us to understand what is happening in our communities and be able to address these misconceptions or misinformation through the different platforms, for example, the radio talk shows or the community mobilization or risk communication interventions. So COVID is more than a public health intervention. As we have already experienced, it has social, political, economic implications. And this is important because we all have a role to play in stopping this disease. So please do your part. I do my part. The government does its part. Everybody do their part to control and to prevent the spread. So travel has also been identified as key in the transmission. Wherever it's going with somebody. So we need to be sure of how we move, so that you don't move and transmit the disease from place to place. For example, now we have the current mode of, the group of people who are, for example, in Uganda, and I think even here, the truck drivers. The truck drivers moving around and spreading the disease unknowingly at times, because at times they don't show the signs and they are intercepted at the borders and they are found positive. All right, so we said that this disease is affected by the stigma. I think the response is affected by the stigma. So stigma or social stigma is a situation where people are labeled, this is a COVID case or corona case, or stereotyped. At first, this disease was, it came into this country through the UN group, and of course there was all that, hate speeches which were going on. So there is discrimination. People are being discriminated against. They are treated separately, and there's loss of status. So all this affects the way people respond. So the level of stigma associated with the coronavirus or COVID-19 is based on three main factors. It is a disease that is new, so there's a lot that we don't know, and for which there is, people have their own imagination around the disease. So we often are afraid of the unknown, and it is easy to associate that fear with others. Initially, because it was coming from a particular country, people were labeling people, and now I think in our own specific countries, we had, at first it was the traders, because they went to countries which were affected and bringing the disease, so they were being labeled. Actually, at times it would be a serious situation, because the communities would come out to say, no, this person went to Dubai, for example. So even if the person is not sick, he's labeled. So because of that fear, people don't come out easily to say, yes, I went to such and such a place, I'm likely to be a contact, can I go for a test? So this is a very serious situation, but they will be, because it's a serious emerging issue, there is a separate presentation which will be available to you. It highlights the impact of social stigma, how we can address it, we as risk communication people, and how others can also address it. The do's and don'ts. What should I do? What should I then do, in order to reduce the stigma? And what is the role? And what is your role in supporting in preventing the stigma? And then you'll be given some communication tips on how to address this. Okay, so the other aspect of the response is to enable us understand how protection from sexual exploitation and abuse during the COVID response. So this is also another area which we have prepared a separate presentation. So there will be a link later on how you can get that. But what is it? Sexual exploitation and abuse is when a UN, international NGO, national NGO workers or related personnel abuses his or her position of power to sexually abuse and or exploit a beneficiary or a member of the population. This is currently it can happen because right now the communities require some support. So at times you might find that you are in this kind of scenario. So this is an area which is also being highlighted within the COVID response, and a separate presentation, as I said, will be provided. So the separate presentation highlights the definition of PS, that is protection from sexual exploitation and abuse, the core principles, and what can be done to prevent or respond to the sexual exploitation and abuse during the corona response. Okay, so we've been talking about risk communication. So what is risk communication? This is real-time exchange of information, advice, opinions between the experts who include the community leaders, the officials, everybody who has been empowered with, including you now, because if you get information on this disease, you are, in quotes, an expert who can provide information to people who face a threat to their survival, their health, economic, or social well-being. The aim is to empower these individuals to make informed choices to reduce the risk of contracting the disease. So, why do we do it? Why do we communicate? As I pointed out earlier, it's really to inform people. Forearmed is forewarned. Forewarned is forearmed, whatever. So we do communicate so that people make informed choices to protect themselves, their families, and their communities from whatever risk we're talking about. So we do that by listening and responding to community concerns. Because many times a disease comes in and people know what they are doing, they have their own perceptions, they have their own ways of intervention. So we need to discuss with them, and in that way we can also identify other risks pertaining to this particular crisis. It involves, why do we communicate? Because we need to share information, share it quickly in a way that people trust. So we need to identify ways in which people trust before the crisis comes up. The other thing is we communicate so that we build trust and understanding. Many times, sometimes our mobilizers go into communities and they are rejected or they are chased away. It's because of this aspect of building trust. If they don't trust them, they will probably not even believe what they are saying. So we need to engage everybody. So risk communication points out that the disease or whatever crisis it is everybody has a role to play in reducing or slowing the transmission, for example, of COVID. We communicate earlier to mitigate the impact on the economies, for example, the food insecurity, the social services, and access to healthcare. So we communicate early so that people are able to mitigate the impact of the risk. Okay, so this slide really highlights the different means of communication that are available to us. And it's encouraged that we use different forms of communication to reach different people, and the messages should be the same, reinforcing each other in whatever channel we use. So we have the radios and the TVs. We've been providing messages through there. We have the phones, and we have partnered with the phone companies. So we use the phones to disseminate information in terms of the SMS texts and then the caller tunes. The megaphones are also being used as a form of channel of communication. The public address systems, vehicles mounted with the speakers and loudspeakers and megaphones, and so they go around announcing the message. We have the house mobilization. Our mobilizers are going around. We have the social media, which is very key. If you don't use it well, it will also disseminate a lot of rumors. Community and religious leaders are also key in terms of communication because they are the trusted people in the communities. We have the hotline, the Ministry of Health toll-free hotline, the 6666. This is a key source of means of communication to whoever calls, and the phones are free. And as I've said earlier, that it has been scaled up. Now the capacity has improved, and even the quality of they've included more experts on the team. So we have 25 watch officers who are able to answer questions, but they work in shifts so that there's continuity in terms of availability of information. We have the health workers. They are also trusted sources of information. We have the information and education materials, and we have many other traditional ways of communication, as you probably know. We have a risk communication strategy, and a number of activities that are ongoing. Now, just to mention a few, we have the radio messaging. We've had jingles produced in different languages, local languages, and talk shows providing information to the communities on COVID-19. Orientation of community leaders and stakeholders so that they are up to speed, they are aware of what is happening because they are the trusted sources of information. And we orient them, of course, observing the physical distancing. That means that we don't reach the many people that we have planned, for example. So that is something that has to happen, and it is done over time. We've developed different materials, and we are still creating different messages as issues come up in terms of what the communities need and what other risks we have identified. So these materials have been produced and they are available, and many of you, I'm sure, have seen them, and those who don't, of course, there's an opportunity for you to get some. And of course, as my colleagues pointed earlier, you can always reprint the materials within the guidelines that he highlighted. We've trained our community mobilizers and the foot soldiers so that they are able to effectively conduct house-to-house awareness still observing the physical distancing. They are using megaphones. They are tracking rumors, providing community feedbacks, conducting community engagement in the method that I told you about, that they have to do it in such a way that they reduce the risk. They have to use communication materials by strategically placing them in locations, for example, bars, hotels, markets, strategic places where these materials can be there to remind people about the key messages. There are also guidelines on hand washing, then of course the guidelines on proper use of masks by all, except of course children under 2 years. Then promoting physical distancing, as we said, this is one of the key which we have to continue driving even after after the COVID outbreak pandemic. Right. So what is the role of the community influencers? The community influencers include the community leaders, other opinion leaders within our communities. Because as we said earlier, it's not easy now to engage, to do the community engagement the way we used to do it before, by bringing a group of people together, having a discussion, and then coming up with solutions. So this group of people are very, very key. They help build trust between the communities and the other stakeholders. They share information timely, and of course it is accurate information because they've been trained through direct engagement with the community members, because that's where they live. But of course they have to, of course, ensure that physical distancing is observed. Creating awareness, especially now, as we said, some of the people are sick, but yet they haven't either shown signs or they will never show signs. So there's that group of people. So we need to, they can provide that information to assure people that even if you're not showing signs, there is this problem and you have it. Reporting community feedback and rumors, they are also involved in that. And of course, encouraging and promoting the use of the the Ministry of Health toll-free number, because it has a capacity to reach everybody and provide fast, accurate information quickly. So not everything is rosy. We've had some challenges, but of course we try to see how we can avoid them, overcome them. We have limited access in some locations of the mass media and electronic communication. So where the media can't reach, what else can we do? Limited communication infrastructure. We have there's mistrust of social services, so that is, the messages are built within to address this within what we are providing. Community engagement, I think this one I don't even need to remind you, but it's a good strategy, but in the context of COVID response, it's probably not going to be used the way it is used normally. Partner coordination is key, but again, we have created pillars of different levels of coordination at the national level, at the state level, at the county level, to make sure that whoever is interested in supporting the response, we are together, we meet, we coordinate, and we reduce duplication. Timely information is also at times is limited in terms of how fast we can get the information to the people. The low literacy level, it causes us to provide different formats of the information in order to meet the needs of those who are literate, including those with disabilities. Limited reach of the mass media, because of course people will say, yes, we have radios, we have radio stations, but even at the household level, somebody might not have the batteries, somebody might not have the required resources to make sure that they listen to the radio throughout. There is a problem, a challenge of diverse languages. We are not able to translate or to provide materials in all the languages, but we've tried to provide in the key languages, which is still not sufficient. Standardized messages across all stakeholders. This is key. And again, as we pointed out earlier, there's a lot of information coming through the different channels, especially social media. But again, I've told you that we have rumor tracking in place so that we try as much as possible to mitigate the rumors spreading within 42 hours, within 72 hours. We have also the printing, lack of printing in terms of the turnaround. We have had plans of providing a lot of materials, but because of the COVID limitations in terms of travels, that has been a challenge. So all in all, interpersonal communication and community dialogues are core channels of communication, but in the context of the COVID, we've had challenges. And that's why we have to really remind ourselves how best can we provide information to everybody who needs it, because everybody is at risk. All right. So I told you earlier that we have different layers of coordination, but within our own coordination, at national level, we have the National Steering Committee, which oversees the response. Above that, there is the high level task force, which I think in the few recent days it is changing. But anyway, there is that body at that level which oversees the whole response. Then at national level, we have the National Steering Committee. Within the steering committee, we have different pillars, and among the pillars is the risk communication and community engagement, which is important for us. So within this pillar, we have different subcommittees which address the different thematic areas. As you can see on this slide, we have a subcommittee on materials development and clearing. So if you develop any materials, this is the committee that is supposed to look at your materials, review them, and clear them for use. We have the community engagement and social mobilization. We have the training. We have the rumor tracking, the state level support, the hotline and the private sector partnerships. We have the media engagement. So all these are put in place so that the technical, the technical issues are discussed at this level, and only some strategic, issues are discussed at the technical working group level. So at the national level, we have a national task force, but at the state levels, we also have state level task forces. So wherever you are, please try to link up with any of these the coordination bodies so that we all have the same information and we are we are all contributing the same national strategy, especially the risk communication strategy, to reduce or to mitigate, to fight or to curtail the COVID, the transmission of COVID within this country. So this is the last slide, but my colleague will add on a few points, especially on the rumor tracking. So this just highlights that our key source of information is the Ministry of Health toll-free number 6666. Please do promote the use of this number because it's the only way we can reach people quickly. Our people in the communities, yes, mobilizers can communicate, but again, we've said that they have that limitation in terms of reaching people on time. They have to social distance. There are those limitations which are apparent. So the key messages have to be promoted, but we as individuals, we need to start with ourselves. Look at what you have, what you are doing, and the risks that you are likely to encounter, and start doing the right things.
Thank you very much, Lillian, for your excellent presentation. I just wanted to add a couple of points here. Participants, just to remind you from my end once again that Reuma tracking, and particularly bringing in the community feedback into our system, is extremely important at this moment. This is very clear that this particular disease, COVID-19, which is pretty new, and still we are struggling to know the complete epidemiology and all the other details about it. So people are also longing for information about the disease. And as they receive what kind of information, whatever it might be, people are very much eager to grab, and they start spreading it, whether it is true or false or whatever of nature. So our responsibility is to bring it back to the system so that we can provide correct information. We can feed correct information to the communities, and those misinformation and rumors can be checked at its very root. So for that, we have created a form, which is a community feedback form. We will display that in a while, and we will discuss about it in more details, but mostly it is providing the complete details of whatever the misinformation or rumor, whatever you see in your uh, as you reach out to the communities. You may see it from your social media communication. You may see it through telephone communication, maybe from a community member or a religious leader. So you have the options to provide those information through this Google form. I'm going to display this form, but the bottom line is, as you bring those community feedback to our system, we have the mechanism to create the right message, the true information about whatever it is happening in the community. We can get back to those communities precisely with the correct information through our various mechanisms. In a large scale, we can reach out to the communities by using a radio talk show. There are people like community influencers, they can take part in the radio talk shows. And we have also the other mechanisms like community mobilizers. They can reach out to those community, of course, observing the physical distancing measures, using megaphones, etc. So that way, we reach back to the communities with right and correct information, and we stop the rumor and misinformation right there. So we thank you very much, all participants, to for giving your precious time for this orientation session, and we sincerely hope that you reach back to the communities and you use this particular presentation for all the other purposes, possibly for community mobilization, possibly for your training purposes, whatever. But yes, we expect that this presentation is used for all good purposes. Thank you very much once again. I thank Lillian and all our partners, Ministry of Health, World Health Organization, South Sudan Red Cross, IOM, and all other partners to be on board and to support this orientation for all our cluster and risk communication partners. Thank you very much. Have a good day.